Feeling tired all the time? Is your skin looking a little yellow? It might be more than just stress. These could be silent signs from your liver. And today, we're going to talk about a condition that affects millions worldwide: hepatitis. What is it? And more importantly, how can you protect yourself? Let's dive in. Hepatitis simply means inflammation of the liver. While there are many causes, we're focusing on the viral types A, B, C. And you think of your liver as your body's main filter and factory. It cleans your blood, processes nutrients, and helps fight infections. When it's inflamed, it can't do its job properly, leading to serious health problems. Many people with hepatitis don't even know they have it because the early symptoms can be vague and easily mistaken for the flu. You might experience fatigue, nausea, vomiting, abdominal pain, loss of appetite, dark urine, and joint pain. One of the more telltale signs, though not always present, is jaundice, which is a yellowing of the skin and the whites of your eyes. This happens when the liver can't process a substance called bilirubin. Let's break down each type. Starting with hepatitis A, this one is often called the traveler's disease. You typically get it from consuming contaminated food or water. Imagine eating a salad that was washed with unclean water or shellfish from a contaminated source. The virus is passed through the stool of an infected person. The good news is that hepatitis is an acute infection, meaning it usually resolves on its own within a few weeks to months and doesn't lead to a chronic, long-term illness. Most people make a full recovery. The best way to protect yourself from hepatitis is through vaccination and good hygiene. Always wash your hands thoroughly with soap and water after using the restroom, before preparing food, and before eating. When you're traveling, especially to areas with poor sanitation, be extra cautious. Drink bottled water, avoid ice cubes in your drinks, and steer clear of raw or undercooked food. Now, let's move on to hepatitis B. This type is a bit different. It's spread through infected blood, semen, or other body fluids. This can happen through unprotected sexual contact, sharing needles or syringes, or from an infected mother to her baby during childbirth. It can even be spread by sharing personal items like razors or toothbrushes that might have tiny amounts of blood on them. Hepatitis B can be both acute and chronic. While many adults who get it will clear the virus, for some, especially those infected as children, it can become a lifelong chronic infection. Chronic hepatitis B is a serious concern because it can lead to severe liver damage, cirrhosis, and even liver cancer over time. Prevention is key. There is a very safe and effective vaccine for hepatitis B. It's usually given to infants as part of their routine immunizations, but adults who weren't vaccinated can and should get it, especially if they are at higher risk. Practicing safe sex and never sharing personal items are also crucial steps to protect yourself. Next up is hepatitis C. This is another type that's primarily spread through blood-to-blood contact. The most common way people get hepatitis C is by sharing needles or other equipment to inject drugs. Before 1992, when widespread screening of the blood supply began, it was also commonly spread through blood transfusions and organ transplants. What makes hepatitis C particularly tricky is that it often becomes a chronic infection without showing any symptoms for decades. Many people carry the virus for years, even decades, before they are diagnosed, by which time significant liver damage may have already occurred, like hepatitis B. Chronic hepatitis C is a leading cause of cirrhosis and liver cancer. Unfortunately, there is no vaccine for hepatitis C. The best prevention is to avoid behaviors that can spread the disease, primarily avoiding illicit drug use and sharing needles. If you're getting a tattoo or a piercing, make sure you go to a reputable facility that uses sterile, single-use equipment. Modern treatments for hepatitis C are now incredibly effective, with cure rates over 95%. So getting tested if you think you've been at risk is vital. Finally, let's talk about hepatitis C. This one is similar to hepatitis A. It's mainly transmitted through the fecal-oral route, typically by drinking contaminated water. It's more common in parts of the world with poor sanitation. In developed countries, it's sometimes linked to eating undercooked pork or venison. For most people, hepatitis C causes a short-term, acute illness, and they recover fully. However, it can be particularly dangerous for pregnant women, leading to a high risk of acute liver failure. It can also become a chronic infection in people with weakened immune systems. Like organ transplant recipients, prevention for hepatitis C is similar to hepatitis A. Be careful with what you eat and drink, especially when traveling, and cook meat thoroughly. So, we've covered the causes and symptoms. But can natural or herbal approaches help? It's important to be very careful here. While a healthy lifestyle is crucial for liver health, you should never try to self-treat hepatitis with herbs without consulting a doctor. Some herbs can actually be harmful to the liver, especially a liver that's already inflamed. However, certain herbs and foods are known for their liver-supportive properties when used correctly as part of a balanced diet. Milk thistle, for instance, contains a compound called silymarin, which is often studied for its liver protective effects. Turmeric, with its active ingredient curcumin, is a powerful anti-inflammatory that can help reduce inflammation throughout the body, including the liver. Dandelion root is another traditional remedy often used as a liver tonic to support detoxification. Eating a liver-friendly diet is also a fantastic protective measure. This means focusing on whole foods, lots of fruits and vegetables, especially leafy greens like spinach and kale. Berries are packed with antioxidants, healthy fats from sources like avocados, nuts, and olive oil are beneficial. It's also important to limit processed foods, sugary drinks, and excessive alcohol, as these all put a heavy strain on your liver. To sum it all up, protecting your liver is a combination of awareness, prevention, and healthy habits. Get vaccinated for hepatitis and practice good hygiene and safe behaviors. Be mindful of what you eat and drink, especially when traveling. And if you have any symptoms or think you might be at risk, please go and see a doctor. Early detection and treatment are critical for preventing long-term damage. Your liver works hard for you every single day. Taking these simple steps can help ensure it stays healthy for a lifetime. If this video was helpful, please give it a thumbs up and subscribe for more health tips. Thanks for watching.